Welcome to Inside Health on Signature TV. This is a show where we break down complex health challenges on topics into bite-sized information meant to help you take charge of your health and your well-being. Well, as nurses commemorate National Nurses Week from the 6th to the 12th of May this year, we'll be discussing an important topic: hope, healing, and heroism, the role of nurses in Nigeria's evolving health system. We're going to be answering a couple of questions. For example, what exactly do nurses do in the grand scheme of things in the healthcare ecosystem? Well, I'll introduce our guest right after this break, but you can be a part of this conversation. We are live 247 on YouTube at Signature TV Official. Go like, comment, share, and subscribe. Of course, we're also live on SLTV channel 265, and you also have the opportunity to go and download Signature TV app from your Google Play Store. Don't forget, more of this will come up right after this time out. To stay with us.
Every second, every minute, every day, news is breaking. Events occur and there are new developments. At Signature TV, we follow these stories objectively, bringing all sides without bias, explaining the complex issues, breaking down the numbers, and investigating the issues behind the news. Anywhere and everywhere, near or far, wherever the news is, we will be there. Signature TV. News in your pocket.
Well, if you're just joining us, this is still Inside Health on Signature TV. I'm your host, Chigi Chiagorom, and today we are talking the role of nurses in Nigeria's evolving health system. Our guest is a nurse practitioner and a nurse tutor. Nurse NNAJIANI is a GINIDIKANWA. Good morning, sweetie. Thank you for joining us this morning on the show.
Good morning. Thank you. Thank you.
So we have been talking, and it seems as though we've known all our lives.
Yes.
So we're comfortable with each other right now.
Very comfortable.
So tell us, National Nurses Week. I had to check it. I had to look it up. It's not international.
No,
So
yeah, of course.
this is for us what the Igbos will say in Kabunkai.
It's true,
Right?
it's true, yes.
So tell us, why National Nurses Day? Why not an international, key into an international event that is already there? Why do we have a National Nurses Day? What is it for?
Okay. Well, first and foremost, the National Nurses Week actually is kind of integrated together somehow with the international.
Okay.
To say that, I will have to dive into a little, why do we do it at this particular point in time?
Okay.
Like if you go into the social media now, Twitter, Facebook, TikTok, everybody, Nurses Week, Nurses Week, Nurses Week. Yes, it's because we nurses, in as much as we are so choked up with a lot of work in the hospital, every other aspect areas of our lives, we have to create out sometimes to celebrate ourselves.
Indeed.
Yes, we say that some heroes wear cap. We don't wear cap. We wear scrub. We wear injections and all that.
And gloves.
And gloves. Thank you. So we celebrate it because this actually 12th of May is when they delivered our founder of the modern day nursing, Florence Nightingale.
Yeah.
That was when she was delivered. So we tried to create it within 1 week.
You mean that was her birthday?
Her birthday, yes, when she was
giving birth to.
Yes. So we try as much as possible to celebrate our Nurses Week within that week that they gave birth to her. So from 6th to 12th, we try to kind of celebrate ourselves as nurses. Okay,
so it's
and also in remembrance of her actually too.
Yes, keep her memory alive. So it's not about an awareness of a healthcare issue. No. It's just to sit back, let your guards down, let your head down, celebrate yourselves, celebrate how far you have come and things like that. But are there aspects of nurses' welfare that, you know, is talked about, or work environment, just anything around nurses aside from, you know, relaxing and celebrating yourselves, that are championed during this, you know, period? And tell us about some of the activities that you used to commemorate, because it's a week-long celebration.
Of course,
So yes, because when you get to hospital, you're just talking about social media. It's not just about social media. Even on ground, in hospitals, you will see nurses with their, you know, their caps and their scarves, and So tell us, what are some of the activities that will, you know, make up the one full week of a celebration?
Well, actually, that 1 week is not as if all work and hold. It's not as if we nurses are not still doing our jobs as nurses in the hospital. It's not as if we are not carrying out our responsibilities to our patients in the hospital. But in as much as we're doing that, we try to also remember that we are celebrating ourselves. We are doing it with love. We are kind of putting out to the world, take care of yourself. We are health educating too within that process. In as we try to inculcate other activities like fun, like my alumni, ESUCOM, currently the Enugu State College of Nursing Sciences. My alumni, we try as much as possible within that 1 week, we kind of arrange ourselves, go out for an outreach. You can go to those areas that are kind of under-resourced. You go there, teach them. If you have some free medical activities you can give to them, we give them. Free checkups, all those things, medication, we give it out to them. It's also a way of returning back to the society, appreciating them, and also health educating them about their health, health promotion, so many other things. We also try to even, sometimes we put in party, gala nights, all those things, just to celebrate ourselves, to have fun.
All right. Interesting, because when you were talking about outreach, I was like, yeah, really? But I thought it was to celebrate the nurses, and you're still doing, you know, humanitarian work and trying to celebrate. So it's a beautiful thing. So who is a nurse? In clear, simple sentence, who is a nurse? Because what we know of nurses are women, to start with, women who wear white gowns with pocket clocks and biro, different, you know, red, black, with a cap, you know, and, you know, pristine white, you know, walking around in hospital wards. I know nurses are much more than that. So who is a nurse?
Actually, let me say that a nurse is an individual that is driven by passion.
Okay.
Yeah. In as much as that it is a specialty that a profession that you have to go into, train yourself, become licensed, and to start practicing to nurture and take care of people. You have to be driven by passion. If actually you're a nurse and you're not driven by passion, that means actually query that your nursing.
But every discipline actually demands some level of passion
for you to be able to deliver.
Yeah, for you to be able to deliver. So who is a nurse?
A nurse
is
a well-trained specialist, or a specialty that you're trained to train, because you train also as a nurse.
Because you're a tutor.
Yes. Okay. To train, to care, to health educate, to teach people about their health and their well-being.
Interesting. Now, I don't want to jump, because we have a segment where we glean comments concerning this particular topic from social media. You know, and myth busts. We'll still get to that. So the question I wanted to ask was going to point towards that, but let me trash it for another question. We'll still get to the myths, where you get to bust on myths. Okay, so now, as a nurse, where, apart from the hospital, where are you expected to work? Because nursing sciences now has become somewhat of a hot cake.
Of course. Even
in schools, I was discussing with a colleague the other day about the fees, about a new school, a federal school though. It turns out the fees for nursing sciences was much more than other, you know, health science related. So aside working in the hospital, where else can a nurse work?
A nurse can work anywhere
Okay.
As a nurse, you can also work under a non-governmental organization. As a nurse, you can even work in a pharmacist shop. It's not a must that you must work at the hospital for you to be able to deliver. A nurse can even go national. You can join national in the sense that you can join some of our bodies like National Association of Nursing and National Association of Nigerian Nurses and Midwife, like NAM. It is a body that has to do with policy making, influencing the policy. Yes. So it's not just only about working in the hospital. There are so many sectors that you can actually deliver your services that are needed.
Yeah.
You can even work at the rural areas. We have so many primary health centers there.
But do nurses really want to work in primary health centers?
If those actually, the infrastructures and the things that are meant to be there are there, nurses will love to do that. Because there is this joy that comes to you that there are some mothers that you see, a pregnant woman that you see that she has been pregnant for like from the first month to the 9th month. She doesn't even know about antenatal. But when you're there, you teach them. It's not even if you are not coming to the hospital to start taking all those drugs and all that, but those vegetables around you, those fruits around you,
even hygiene,
a lot of things you can tell them. And when you see them pass through all those things and they are healthy with their baby, it brings a lot of joy to you. Okay, so it's not just about you're working in a government or hospital or in a private sector. There are so many areas that you can see yourself and you will still deliver effectively.
Right. You have spoken to other places where nurses can work, but particularly I want you to talk about policy making. Now, you said your association, the NAM, are nurses employed there with nursing certificate, or they have to read some sort of an administrative course or something like that, or with your nursing certificate you can actually get a job? Tell us about it.
Okay, you can actually, you don't need to be trained or something to join. As a nurse, you're already licensed. You can start working in a hospital setting. And as you're working there, you have your experiences depending on where you've been posted to. You gather your experiences and all that. You can decide, okay, you form a body. We have a body, just like in Parkland, we have a body. They do election. That's how somehow nurses go into politics. But it's not the politics to go and be fighting and you want to be a governor, a president. Aspect. Yes.
There's nothing wrong with a nurse being a president or
at all. There's nothing wrong.
Yeah.
But there, we're actually focusing about our patients, about our working condition, about a lot of things about nurses and the health. So that body, you don't just need to just come in and join. You have to have this expertise. You must have developed yourself to a certain standard that if you come out, your integrity is there too. Because people can vouch for you that you can actually speak for them, you can actually perform and deliver. Then when you come out, I want to do this, I want to do this. You have the support of your fellow colleagues. They will put you there. It's a body that is inside nursing already. You just affiliate yourself. You just join them, apply. With your election, you join, can become a secretary, you can become also treasurer and all that. But all of you are now working together to speak for the nurses. It's just like a labor union. Okay? You're fighting for the workers, about their benefits, their compensation, anything that is due for them.
So whatever experiences you glean from there, you can use it to push further.
Thank you.
Okay, so as a nurse, right, what are the different areas of specialization? I know with doctors there are a plethora of them: pediatrics, radiology, O&G, that's the OBGYN, a lot, internal medicine, family medicine, there are lots of them. All right.
Yes.
Even with medical pharmacy, they also have their own specialties. Yes. What are some of the specialties, in nursing sciences?
Okay, we have, like all of us, we are conversant with the midwifery.
Everybody knows. Nursing and midwifery. Everybody
nursing
knows
and midwifery, thank you. We have our pediatrics too. You have emergency nursing. Yes, we have ICU nurses. Those nurses that work at intensive care units. We have the oncology nursing. There's so many. Yes, we have nurse as a nursing research. There are so many areas and specialties we have in nursing. The only thing here is just that we're in Nigeria, we are kind of limited.
What do you mean by being limited?
Because those certain areas or those specialties that nurses need to move into, in fact, they are needed. so much. It's just that we don't have those things here that will give us the platform to deliver. We don't even have those people that will train us to in that particular specialty. I have a friend of mine that is she's outside, she's not in Nigeria. You can see that a nurse there is actually a consultant in mental health. We don't have that kind of...
You call yourself a consultant, a nurse in Nigeria.
The doctors will not even allow you to.
Are you kidding
So
me?
we have so many specialties in nursing.
But since you are mentioning these gaps, I'm sure that the Nursing Council, they are aware of these issues.
Of course.
Is there some kind of advocacy using the National Nurses Week as platform to, advocate
about
yes, because I know pharmacy has actually gotten their consultancy, yes. So is there any advocacy using this National Nurses Week as platform?
No, definitely. There is. A lot of people have been speaking out and they are discussing it, and a lot of meetings have been going on. So they are working on it a lot. And we hope that it will be successful.
Okay. Now, in the words, I think it's safe to say that most nurses work in the words,
yes,
right? There's this notion that nurses are wicked. Okay. The nurses are, especially with the OBGYN, women who give birth and things like that. Why do you think that is? If that is a reality, but most people feel nurses, because our topic says hope, healing, heroism. So if you have to give hope, you have to be kind, you have to be empathetic, compassionate.
Caring.
How has that been for you? And can you speak to this as regards to how your colleagues behave and things like that?
Oh, well, let me apologize for people, the way they feel towards some nurses, their attitude and their behavior and their character. It is not acceptable. Even when we are taking our nursing oaths, is there not to do that? A lot of things you've already sworn as a nurse not to do. So if anybody must have encountered any kind of misconduct from a nurse, their attitude and that, I apologize on that. But speaking from my own angle, I'm not painting myself an angel or a saint, but when you go into the world, you are seeing a patient you're not related to, you're not connected to this person. And that is where I tell you that is where passion comes in. That is where compassionate comes in, caring comes in. You're looking at this person, while you're there, that person is already seeing you as my hope. You are here to heal me, you are here to assist anything that you can do for me to get better. So we nurses try as much as possible to fill in that gap, to stand in between and be rendering those services to the patients. But I can actually quote it that so many nurses act out of maybe, let me say, their individual character and order. Our system is not really helping out in some certain ways. You see a nurse that wants to administer some medication to a patient. You see that there are no requirements enough for you to even care for these patients.
You mean like materials, PPE?
Yes. You don't, so many nurses will come, no gloves, no, you get, to even take care of these patients. And you remember, you also is a human being. In as much as we're caring for these people, you also protect yourself too, and also for your loved ones too. So many of them act out of frustration. So many are even acting out that they are not delivering effectively and efficiently how they should. Because the things that will help them to work is not there. Okay? And then at the end of the day, they pay you peanuts. You have bills, you have your own responsibility. In as much as we have our threshold, it's not the way I take things, it's the way you take. So so many people can flare up and act out on another people. That is not the cause of their problem. So that's where this frustration comes in. And you know, nurses are kind of, we and patients are like brothers and sisters. We are there 24 hours. The night nurse is going, the afternoon nurse is there, the night nurse. So you are not just running away, you are there 24 hours. So you keep the same thing all over again.
So it's interesting, really, when I think of how nurses always are very close to the patient, much closer than any other healthcare. Do you think that the recent Japa syndrome has actually increased the burden of nurses in Nigeria? Because I think it's okay to say that more nurses leave than even medical doctors. So you will come to a hospital and a nurse attends to you. By the next week, they tell you the nurse has traveled out of the country. Now, can you evaluate the number of patients per nurse now?
Oh, God.
And how challenging it has become?
Wow. You can see a ward that has like 20 patients and it's just 2 nurses are on duty. Can you just actually sit down and imagine a ward of 20 patients and it's filled up with patients with so many chronic diseases, so many medical conditions that you might even, as you're trying to resuscitate this person, the other person is screaming,
Calling your attention.
The Japa is, in fact, if he's like 50, now he's at 100. A lot of people wants to go out. And as they're going out, the small people that are around are the ones suffering it. And the patients too are suffering because a nurse cannot be able to divide herself into 20 to be able to take care of all those patients. So you see that you can have to kind of, in as much as you're trying to prioritize the most critical patients to attend to, other people still need attention. We can't divide ourselves, so the burden is too much. It's too much.
How do you take care of your mental health as a nurse?
It still boils down. A lot of us. In fact, when we talk about heroes, there are some people I think we nurses need to appreciate in some certain ways. I'm so sorry to divert away. You see the husbands of nurses, those people that we are married to, they are trying. A lot of them, a lot. They are the ones that kind of carry up some of those responsibilities.
In the home.
When you face that one in the hospital, you still come back to your own family, a lot of things. So they are actually some of our heroes that we have today.
Interesting.
We add them even during this our nurses week to celebrate them too, because it's not easy. You carry that frustration sometimes and come back to them because you can be losing your mind. It's just like there's this child. I will never forget that child. A small child, I think 6 months, in pediatrics ward. You have just been there from the admission process, following this child up. Are we getting it? You're there giving them hope. The much you can, you are rendering the services as a nurse, and at the end of the day, this child will just come and die. And you see the parents crying. A lot of things. Those things can even affect you mentally.
Yes, emotionally.
Emotionally, you're down.
Do you think that's why nurses tune out and it's as though they don't have human sympathy?
Exactly, because
that could be their coping mechanism.
Thank you. We have. That's our just defensive coping mechanism. We try as much as possible not to show that our emotion,
or not to be attached.
Not to be. Actually, as a nurse, you're not to be kind of attached to your patient. We have our interpersonal relationship we should have with a patient. Are we getting it professionally? So that whatever happens professionally, you try as much as possible to absorb it with your shock absorber. So you don't extend the relationship to avoid yourself being weighed down that much.
Obviously. Now, what's the relationship with doctors? I know there's this unwritten script that says that doctors are the champions in healthcare delivery. How has it been? I remember one time in Federal Teaching Hospital here in Enugu, nurses used to practice anesthesiology, but after a while, I think doctors took over. Do you still experience such rivalry in your practice currently, or you have just a beautiful cordial relationship? Are there some challenges relating with doctors, professional challenges relating with doctors, and other healthcare
okay, well, I'll start with doctors. There are some battles that have just been there. It can't just stop. There is this rival that is always there. Even in Parkland, the doctors have actually, in the labor ward, they've actually taken over labor. You can imagine, as a midwife, you are there and the doctor is dragging that this is their responsibility, this is what they want to be doing. So the rival is always there. And that is where it still boils down to what? This policy making, both for nurses and other fields. Let each and every one of us come to an agreement. These are the specialties. This is what is expected for a nurse to do. This is what is expected for a doctor to do. This is what a pharmacist to do. And everybody have their boundaries. It's because we are in a lawless place that there can be these fractions all the time. Okay, you can't see this kind of rivals in outside a developed country. Okay, it's just here we drag a lot of things. I don't know why.
Do you think it affects your healthcare service delivery as a nurse?
Very well, very well. When a midwife is in a labor ward and she's there, She's already trained. She has the license to practice, and it's not as if she doesn't know what she's doing. But this her work is taken away from her, and at the end of the day, it makes her not to deliver
So
effectively.
if the work is taken away from her, what does she do again?
Exactly. You can now see her maybe either assisting or doing one or two things. But at the end of the day, the doctors will still come to an agreement and see that it is still, they can't even do it. They can't do this 24-hour shift that we're doing. That is just the fact. In as much as they do their call, they can't come and stay this morning, afternoon, and night. So they'll
Can you differentiate between a call duty and shifts?
Okay.
Because you said 24 hours.
What? 24 hours.
I'm already. So what does that? What's the difference?
Okay.
Doctors do calls.
Doctors do calls.
Nurses do shifts.
Nurses do shifts. Yes.
Okay. What's the difference?
But the nurses that work in the theater, they also do call. When you're doing call, it's just as if you're going to be there throughout the night. Like you start your call midday, afternoon, throughout till the next morning, and that is a call.
Then you go home.
Then you go home. But shift is either you come for a morning duty from morning till 2, and you're done for a morning shift. Afternoon starts from 2 to 8. Afternoon shift. Then the night shift take over till the next morning.
Okay.
That is a shift.
Okay.
But it still depends on the institution. There are some institutions that work shifts, double shifts. You see someone coming in the morning from 8 in the morning till 8 in the evening. That's a shift. It's still like a shift, but it's called BD, morning and night.
Okay.
But like so many federal or state hospitals, they operate with 3 shifts: morning, afternoon, and night.
Okay. How do you deal with quackery? Because in our local parlance, there are people who are called nurse Eliza. Right? So how I know, of course, I know. I don't know if you're an official with your council that has the oversight function over these things, but how do you guys deal with quackery?
Well, quackery, I think even if you look over to the social media now, you notice that there is this increase of, I think they are kind of arresting and trying to fish out so many of them. They are taking them in, trying as much as possible to curtail that quackery. There are some things you see, you don't even need to drag it. I sometimes blame the people that go to those quackeries for their services. Understand where I'm coming from. Quackeries is always everywhere. In as much as nursing their own is always loud, obvious and all that. Quackery is everywhere. There are even some people that you see them wearing lab coats going around. I tell you, they are doctors too. Still quackeries. They don't have license. But you should ask yourself, this person, does he or she has anything to lose if anything should happen to my life? Me that is going to this person to give me injection, to give me drug, to do this and that. If anything should happen to me, will this person be revoked? Will this person be disciplined? That's the question you should ask yourself as an individual. A registered nurse, are we getting it? Or even a doctor that is licensed, before you do anything to a patient, you know that your license is at stake. When your license is taken from you, you have nothing. You are just empty. You are going back to zero again. So that is why a proper assessment of a patient should be done. It's not anyhow drug you see give to a patient. You have to follow a patient up to know how to manage that patient. If it's not within you, like now we have our specialties, you refer a patient. Quackeries don't refer. They believe they are miracle workers. They can do everything. So you that is going to a quackery, that's where my blame comes from. You should value your life.
But people do better when they know better.
Of course.
Because once someone has this air of, I'm a health person, the person is automatically a doctor if he's a man, or a nurse if it's a woman. All right. So are there awareness campaigns or things like that the nursing council or nursing association they embark on? Can you tell us about some of them and how they are run?
Okay, a lot. Like just like this outreach I used to tell you is also a process. Within that outreach we do health education. We talk about health promotion. We'll try to tell people about healthcare practitioners. This is this person. See what this person can do for you. See what this person can do for you. If you are sick, go to the hospital. Start from the primary healthcare. Even if you don't see anybody there, you can take that little money that you can give to that quackery. Come over to this inside the state. You will see a lot of either private, either state. Start from somewhere. go to a hospital that is registered. Okay, so you don't just go around and meet anybody that tells you that they are nurse or they are doctors and all that.
Interesting, because you wouldn't ask someone to give me your license. Let me see your license. Let me know if you're licensed or not. So these are the things you look out for. You only meet them in the hospital.
Yes.
Okay, so while you were talking, you did mention 2 nurses might be in charge of 20 patients in a ward.
Yes.
So my question is, what exactly do nurses do in the ward? This patient is calling your attention, that patient is calling your attention. What exactly do you do? Assuming you're on night shift or afternoon shift, what are you there to do? When there are patient relatives that could attend to the patient, so what are the roles of the nurses? Yes.
In the clinical setting now. The nurses, just like you said, what do the nurses do in the ward? It depends on the ward the nurse is actually working. A nurse that is working at accident and emergency is different from a nurse that is working at the pediatrics ward. It's different from that. The services, that's what I mean. It's still the same nurse. But the nurse that is working in a medical ward is different from a nurse that is going to be working in an orthopedic ward. So it depends on the condition of the patient. So I like using ASUCOM, that's where I'm coming from. Each of our patients, after they have been reviewed and kind of assessed and looked through at accidents and emergency, they are referred to a ward partaking for their particular condition. So in that ward, there are a lot of things that nurses do. You start by doing what? Your orientation of your patients around their place, wherever they are kind of acquainted with the environment. We do a lot of things, just like I keep saying, depending on the condition of the patient. So many of them come with a lot of wounds. You do your wound dressing. You do your general health total assessments of your patients daily. You document everything you're doing for your patients. You give your medication. Relatives cannot give medication. Like there are some drugs I can give you now. I'll write something. Yeah, you look at it, you don't know how to take this drug. I can write a drug and I'll write Nocte. A relative can be looking at what is Nocte. But a trained nurse looks at it. They know this is the time I should give this drug. A nurse should do that. So it's not the responsibility of the relatives actually to be kind of caring for their loved ones. That is why a nurse is there.
Let's talk about trauma. What's the role of the nurses in accident and emergency?
A lot. Wow.
They bring a gunshot wound.
A lot.
What does a nurse do?
A lot. A lot. You have to be as active as anything you can think of, because it's called the golden minute. Any mistake at that time, you can lose that patient. You should make sure that all the requirements you need, the resuscitation tray, the oxygen, everything that you need to work with is available for you. Because any kind of case can come in immediately, so you need to be ready. Immediately your patient is rushed in, you should assess your patient immediat's You have our vital signs.
Because case in point now is a gunshot wound individual. Even before, what's it called? Police reports.
I know that's where you're going to
pay, consultant, all those, the whole 9 yards.
Yes.
Even before all that.
Okay. How will I put it? It's just, I keep putting Nigeria. It's just that it's here. If it's in a developed country, I keep saying it, they save life first, which is the key thing about nursing. We have to save life first. But here, we are still developing. That is why so many health sectors, hospitals, will ask you to actually do what? Kind of make a deposition or even kind of water card. That kind of get card, pay for card.
But
are we getting it?
Would you be attending to the patient while they are going for the card?
Yes, we do that. But the problem is that you see so many patients, they are dying. They'll rush them in as a nurse. You can't, in fact, you'll be so kind of troubled if you're not helping out, okay? And you're doing that. And you see, after doing that, you know, emergency can be so crowded. Forget that we are here seated. You can see an emergency ward that is flooded. You will not know who is patient. You don't know who is relative. You don't know the people that brought anybody in. And
there's no way to do triaging?
You do with triage. What I mean, triage, what I mean is that as you're finished, maybe you're kind of resuscitating. This person is a little bit calm. So let me go over to this next person and all that and all that. And you see that person that is a kind of, the injury is mild, it's not serious. You've attended to what you can. The patient will gently walk out of the ward. You will not know. They will not pay for the hospital bill. Are we getting it?
Wow.
Yeah.
Shouldn't that be the fault of security?
Thank you. A lot of defaults in the health sector. So that is why so many hospitals, so many people must have disguised themselves. The relative will tell you, let me just get something here, and they will run away. They will not pay for the hospital bill. So that is why they now made this emphasis that you must at least commit something. So that we ourselves, because those things you're committing, they use it to buy the little those things too.
Yes. So. Interesting. We are still talking with nurse GINIDIKANWA NNAJIANI is a labo. Interesting name. We are still talking about the role of nurses in Nigeria's evolving healthcare system. When we get back, we'll discuss more on the myths that are making the rounds on My Doctor and I segment. To stay with us.
We are local.
We are right now with the wife of the man that was
Why the main market is in chaos. People
We are national.
Those in support of this motion as amended, say aye.
Aye. We have taken the vote by default.
We are international.
Israeli airstrikes.
Donald Trump left us the worst unemployment.
Signature TV, news in your pocket.
All right, welcome back and thank you for staying with us. We're still discussing the role of nurses in Nigeria's evolving health system. Nurse Ezelebo is still in the studio doing justice to our questions. Welcome to My Doctor and I, where we glean information from the net and we get our guests to respond. It's My Doctor and I, but incidentally, we have a nurse in the studio. All right, are we good to go?
We are.
Okay, so Raymond Agu from Omoko says, please, presenter, ask the nurse, what is the reality behind the uniform of nurses in Nigeria? But they are changing now. Nurses wear scrubs now. So tell us, what's the history of the uniform of nurses?
Well, just like I said earlier, our founder of the modern day nursing is Florence Nightingale.
Yes.
If you actually try to go and watch the picture of Nightingale, Florence, what she was wearing, why nurturing for those 6 soldiers that time
During the
World War. Yes, that war between, I think, the Italy and I don't know, London. Yeah, I think so. So you will notice the attire she was dressing is just this apron that we are wearing now. Yeah, with a gown, but sometimes it's white, and she moves around with a lantern. That's why they call her lady with the lantern. Yes, and whenever she's walking, she glows with that her uniform. And that is why a nurse is expected that whatever uniform you're wearing should be a reflection of light.
Interesting.
That was why white came in.
Interesting.
The modern day nursing, we keep rebranding, we keep trying to be modernizing.
So what's the change in paradigm now that
That
we
they
want to be like doctors that wear scrubs?
No,
Everybody's wearing
actually-
scrubs. It's not just nurses. I mean, even
Thank you.
other healthcare
But
professionals.
the scrub of a thing should actually only be worn in a theater. Yes, because it's a trouser. It should give you that as in case if you're running around, and those people that are working in those emergency units, like the emergency, the NICU, the intensive care units. Okay, the uniform should be worn on a normal day, our white and our cap and all that. But we wear that scrub for a place that will allow
active.
to be working.
Okay, so Hyacinth Madu from Oka says, please, ma, are you aware many Nigerian nurses work 12 to 18-hour shifts with little or no break? I want you to respond to this one. Although you're not a policymaker yet, but at least respond to it.
Yes, exactly. That is one of the things we just said earlier about the frustration. You can see a particular hospital, just like I said, some private sectors, they will use a nurse to work virtually, if possible for them to, they will even want you to work for 24 hours. And they will pay you nothing, no break, nothing. So it is not advisable.
It's not advisable.
Because the person in question will break down.
Interesting. All right, so Peacemaker from Calabar says, nurses in Nigeria often cater to 30+ patients, as if you knew, at once. alone against what you have in other countries. What's the way forward?
Oh God, God have mercy. A lot. In fact, we have to start from the beginning to change a lot of things. Okay.
But there are nurses out there and they are looking for jobs.
Exactly. But now you check the structures that we have. You see that do they have enough money to pay the nurses? That's what they're running away from. Even these private hospitals that go and hire those auxiliaries, because they cannot pay a trained nurse. Because you can't see a nurse that must have gone through the normal training first year, second year. Do you know how much parents pay for their daughter or their child to be a nurse? And then the person will come out and tell that person to come and be working where they are paying him or her 20,000 naira a month. It's not even enough for this economy. So they are actually running away for the payment.
All right. So Credo from Abuja says, "Did you know 7 out of 10 Nigerian nurses want to leave the country?" It's it's obvious.
This is 7 out of 10.
It is
Or
obvious.
Is it 10 over 10? Everybody wants to leave.
Okay. This Azizat from Ogun says, "Why? Poor salaries, no equipment, zero support." Something we just spoke to. Okay, moving on. Ugonni Adams from Aba says, "Presenter, do you know Nigeria trains great nurses just for other countries?"
Exactly, because when they japa to those countries, you see them go there and they will excel.
And they do so well, and they pay them so well. I guess that's even the motivation for the increase in whatever when nurses are going in for training, because they feel you're going to Japa as bringing in the dollars.
Exactly. But in as much as that, they are bringing in the dollars, but they are self-fulfilled.
Because they get to diversify.
Thank you. And that's services that you're rendering. You have a lot of things at your disposal to work with. You don't need to, if you want to take a patient's sample, you come and start puncturing, keep puncturing, injuring the patient just to get a vein.
Yes.
But then they have a vein finder, something that you can just place, to give you the vein. So who can see where there's this kind of is somehow.
I want to talk, but I won't talk.
Don't talk.
Okay, so moving ahead. Udwak from Uyo says, "Nigerian nurses often work without gloves." I guess these are all nurses, trying to recount some of their experiences. Kate Wole from Oshun says, "We can't demand miracles from nurses. We refuse to equip." I guess these are all nurses. Okay, so Beauty Jackson from Ota says, "Many nurses suffer anxiety, depression, and physical exhaustion."
Exactly.
We spoke to that just a while ago.
I'm telling you.
The nurses really and this Nurses Week is a good time to remind nurses to take care of themselves.
Exactly.
All right, so Goodness from Enugu, I'm guessing this is the last one. Okay. As a nurse, I cried after my shift. I couldn't save her. We had no oxygen. Have you had any kind of experience like this where you lost someone because...
A lot. You rush in, you bring in the oxygen, and just within 2-3 minutes it will finish. They'll tell you that, or even the extent of the patient telling they don't have money to purchase it. The oxygen is there sometimes. Can you give it to the patient so that we can actually, they'll tell you to come and pay. No oxygen. A lot.
That is sad.
It's so sad.
Somebody said, "Just don't get sick." Whatever you do, don't get sick. Okay, so Dozie Ogo from Auchi says, "No hazard pay
at all,
no PPE, but we're called essential." This is quite interesting.
Exactly. Like this PPE is a personal protective equipment.
Yes.
Those things you should wear as a nurse
to cover yourself.
So now you still, after rendering, maybe now you're nursing and you're taking care of a patient that has been diagnosed of tuberculosis. And it's airborne. As they're coughing, they're releasing it. You don't have face masks to work with.
Even patients that are bleeding that could be HIV positive.
Hepatitis too. Can be so deadly.
And people are not paid hazard allowance.
So in case if anything happens. So how would that person actually be working with their, full spirit and full chest?
Please, we still have to work with your full spirit.
We are doing our best, definitely, because you can still watch that person.
Because sometimes it could, the life and death, of course, in the hands of God, but it could also be in the hands of a human being.
Of course.
When the doctor is not there, it's just the nurse, maybe in the night. It's just the nurse that will be there to attend to the patient.
Of course.
All right, so let's bust some myths. Are we ready?
Of course.
Nurses are doctors' assistants.
I beg
Only.
you not. We are not.
But okay, and it didn't start as that.
No,
it didn't even start as that.
No, it didn't, because the Nightingale actually that was doing it then, I think she was the first person to form the school of nursing, like a nursing school as at back then.
That one should be very interesting because nobody taught her nursing.
Nursing. She just started by, she saw that these soldiers were seriously injured, and at the end of the day they keep smelling and decaying, and she just felt within her that, okay, what if we keep keeping this wound clean? She started with hygiene.
Just
That
wash,
was
keep it
hygiene,
clean.
yes, and healthy living. So
Was that when Fleming got the antibiotic and was
I think that was later.
1940 something?
That was later.
Okay, okay.
Yes, that was later. But she started.
She's a genius.
I'm telling you, she started with just as simple as hygiene. Goes around in the night. She goes there, keep cleaning the wounds, making it neat, wrapping it with a good bandage, going with the other one, washing it and making it clean.
And she does that every night.
Every night.
Interesting. All right, moving on. Nurses are not educated enough. This is very
It's dicey.
okay.
It's dicey. No,
Okay, depending on the what he or she is talking about.
Yeah, exactly. Because when you're saying educated enough, means that we don't have is it the primary or the basic level? Because if it's about the nursing aspects, we are trying as much as possible to deliver. But just like I said earlier, there are so many specialties that nurse needs to diversify and go into. We don't have those things around at our disposals here.
All right. So nursing is a female-only profession.
It's not
but let's just face this. We have more women.
Exactly.
Why? Is it because the founder was a woman?
No.
Why?
I think now what actually is playing here is the male folks. This ego in them will not allow them. They'll tell you, "Yeah, be why." That is for female now.
Really?
But in my class now, my students, I think I have up to.
Yeah, they are coming up.
Yes,
they are coming up.
Up to 50-something males.
Yes.
And they're in my class. In fact, they are doing much more better than the females in their
because
class.
the human body, sometimes the patients need to be moved.
Exactly.
Patients need to be moved. I mean, you need that physical strength to move.
No, actually, to move.
Yes.
It's not a nurse's responsibility.
Okay.
Yes, we have health workers like porters.
Okay.
We have people that are paid specially for that. The male nurses are actually needed. Do you know why? Like, I think the Hausas and the Yorubas, we are doing that because we're in Nigeria. There are some doctors after seeing a patient and they would need something to perform something like, let me use something like catheterization. You know, catheterization is like passing that, they call it pipe. For a male or a female to use and to pass urine and all that. Thank you. And now, you come to a female and the person that is on duty maybe now is is a male now and you want to catheterize, and the wife of that man will tell you, I don't want you to see my husband's private part.
And she's right.
Female, and she's right, because you have to respect the patient's right and dignity. Now we need a male nurse that can freely come, and you see the wife will freely give in. So you see that they are highly needed.
Interesting. All right, that's a good one. Moving on, nurses are rude or harsh.
We said it. It's not our fault.
They say this person is wicked. Is she a nurse?
I'm telling you. Hey, no. It's not for everyone. Actually.
Yeah, I think times are changing, and besides, I guess the pressure is too much. Like you mentioned.
Yes.
Yeah.
Yes. As much as possible, we are humans. I know that when they are in that situation, that thing is, the emergency is there. They should also know that the person that is taking care of them is also a human. You can't actually see someone that is dying and you just cross your hand and not do something. We do the much you can do, but we are limited with a lot of things.
Yeah. And finally, only doctors save lives.
It's not possible.
It's not possible.
It's not possible.
You think, how would you describe the relationship of healthcare workers? You think is it teamwork, or you think, what exactly are your thoughts?
well, that same way a patient
that clause
actually,
can be true.
that same way a patient sees that that nurse is wicked is also the same way that a failing nurse can actually say that a failing nurse is wicked.
Oh, really?
Yeah. Why I said so is that as a doctor, as a pharmacist, a physiotherapist, all those our teamwork, all of us, the way you relate with them matters. Let's just be frankly saying the truth. The way you relate with people around you matters.
Okay.
If a nurse sees that, if you're a doctor or a pharmacist or this thing, they see that the way you talk to them, the way you approach, the way you discuss and present your case, you are so friendly, so professional. So
You're not coming with any chip on your
attack or
shoulder,
something or anything, or trying to prove I know more than you and all that. All of us will be at the same spirit, the same space. But when you come and to do that to your character, it'll be like they'll just push you aside. So the same way applies to everyone. Even if it's not in the health sector, the way you relate with your partner in the house determines if there will be peace.
Peace. All right, so it's safe to say that healthcare delivery is teamwork.
It's teamwork.
It's not the
100%.
responsibility of one profession.
So
Everybody has to work together to deliver 100% the healthcare to
the patient. Is
to
our,
the patient.
The patient is our
Is the
main
king.
goal, is the
That's
king.
right.
So everybody is there for this person.
All right, and us GINIDIKANWA is a labo NNAJIANI. Thank you so much. I wish we could continue this longer, but incidentally,
Thank you.
we are out of time. So thank you so much for your insight.
Thank you.
Well, there you have it. Healthcare delivery is the responsibility of every healthcare professional: nurses, doctors, lab scientists, pharmacists, you name them. Good luck to everybody, and that's the much we can take on today's episode of Inside Health. Don't forget, you can be part of this conversation, so go on over to our social media platforms on YouTube, on Facebook, at Signature TV Official. Go and comment. We want to hear from you, and you can also download our Signature TV app on Google Play Store, so you can keep abreast of our activities. I'm Chigichiagoram, your host, and don't forget, your health is your wealth. Take charge of your health. I'm signing off right now with health tips. Do take a listen, and bye for now.